Okay. Thank you and welcome for today's discussion. We just thought of giving a minute for the rest of us to join, but in the meanwhile, we can just have some small introduction, basically to highlight the purpose why we are here today. And just to point out that the African Population Health Research Center and the Drugs for Neglected Disease Initiative, DNDi, are pleased to host you on this pivotal webinar titled Bridging the Bridging the Gap Between Research and Policy for Neglected Tropical Disease, NTDs, amid changing funding landscape. So just emphasizing that with less than 5 years remaining to achieve 2030 NTDs elimination targets, and we are in the context of rapidly changing global funding, actionable policy, and in the real world impact. This webinar seeks to explore practical strategies for strengthening collaborations between researchers and policymakers, driving sustainable outcomes and addressing the funding challenges. So we have been able to put up a team of a very powerful panelists in terms of discussing this particular topic. But before we usher in our panelists and introduce them, we will first introduce the speakers to provide the opening remarks from our two organizations, that is the DNDi and the African Population Health Research Center. So the first speaker to provide the opening remarks will be from the African Population Health Research Center, who is Dr. Alphonsus Neba. Dr. Neba is a program director for the Catalyze Impact Initiative under the Research and Related Capacity Strengthening Program. He brings extensive experience in research and innovation management, leadership capacity building, and in strengthening Africa's research ecosystem. Dr. Neba holds a PhD in science and multiple advanced degree in environmental biotechnology, information science, and business administration. He has senior roles in the Science for Africa Foundation, Africa Academy for Sciences, and the University of Botswana. He's a passionate advocate to gender equity, diversity, inclusion. He successfully led the implementation of the renewal of the USAID 170 million Deltas Africa initiative, spanning over 75 institutions in 35 countries. Without much ado, I just want to bring on board Dr. Alphonsus Neba to provide the opening remarks from the APHRC. Welcome, Doctor.
Thank you very much, Johnstone. Good afternoon, distinguished colleagues, partners, and friends. On behalf of the African Population and Health Research Center, I am honored to welcome you to this important dialogue organized with our partners at the Drugs for Neglected Diseases Initiative, DNDi. We gather at a very defining moment. The global health landscape is shifting. Donor priorities are evolving. Domestic budgets are tightening, and yet the burden of neglected tropical diseases remains heaviest among those least able to bear it. Let's pause on that phrase, neglected tropical diseases, for a moment. Behind those words lie centuries of inequity. NTDs are not just pathogens. They are symbols of neglect, of communities excluded from progress, of children robbed of potential, of economies trapped in cycles of poverty because health has been treated as an afterthought. In an age of scientific miracles and artificial intelligence, it is unconscionable and unacceptable that millions still suffer from diseases we already know how to prevent or cure. That is not a failure of science. It is a failure of prioritization. At APHRC, we see research not as an academic pursuit, but as a moral imperative, the connective tissue that binds knowledge to justice. Evidence must not end on paper. It must become policy, practice, and transformed lives. Our mission is to make research irresistible to policymakers, to make it impossible to plan health systems or budgets without the voice of science. This is why our partnership with DNDi is so vital, as we are reimagining Africa's knowledge ecosystems where local data drives solutions, where research leadership is African-led, and where policy change reflects our lived realities. Yes, the funding landscape is changing, but this is also our opportunity to build resilience into our evidence systems, to invest in innovation, to nurture science, to nurture South-South collaborations, and to strengthen research management capacity within African institutions. As we begin today's dialogue, I invite us to think boldly. How can we make evidence indispensable financing models that outlast donor cycles? And how can we forge a new compact between research, society, where knowledge itself becomes a public good? At APHRC, our contextualized evidence, that is, moving beyond parachute research toward African-led, locally relevant studies. Implementation science, that is, understanding not only what works, but how it reaches every community. Policy translation, that is, bridging that vast divide between data and decision, between a journal article and a ministerial brief. The future of NTD control will belong to those who can demonstrate tangible impact, mobilize domestic resources, and build collaborative ecosystems like the one we celebrate today. So, as we open this conversation, let us recommit to a shared vision, one where no disease is neglected and no person is left behind. At EP is the most powerful infrastructure a country or continent can build. And together with our partners, DNDi, and with all of you here today, we can ensure that the fight against NTDs is not just sustained, but ultimately won. I thank you for listening and welcome to the webinar.
Thank you. Thank you so much, Dr. Neba. I think he has been able to bring out very clearly some of the key aspects that needs to be addressed. He pointed out that the future belongs to those who demonstrate tangible impact. And he also pointed out that no disease should be neglected. And I think that is the primary reason why we are converging here today, for us to be able to discuss and find avenues of which we can be able to ensure that no disease is actually neglected. At this particular point, ladies and gentlemen, allow me to bring on board Professor Samuel Kariuki. Professor Kariuki is a Continental lead of Africa and Eastern Africa Director, DNDi. Professor Kariuki is the Eastern Africa Director and the Continental lead for the Africa at the DNDi, formerly Acting Director General at KEMRI. He brings over 20 years experience in infectious disease and antimicrobial resistance, a fellow of African Academy of Science and a visiting professor at Oxford University. He has published over 180 peer-reviewed papers. He also serves as the World Health Organization Strategic Advisory Group on AMR and holds honorary degree from the Liverpool School of Tropical Medicine. Karibu sana, and thank you. Welcome, Professor Kariuki.
Thank you very much, Mr. Johnstone, Kotut, and a very great pleasure to be here. And ladies and gentlemen, colleagues and partners, at DNDi, we believe that science must go hand in hand with policy if we are particularly to be able to deliver long-lasting health impact on DNDi's mission, which has always been to ensure that scientific innovation goes hand in hand to lead to equitable access in the real world, where people who have been neglected, populations that are neglected, get treatment that is effective and that will all change lives for the better. We are in 4 continents since 2003 when DNDi was established. And so far, we have developed 13 new treatments for 6 of the most deadly neglected diseases, affecting huge populations, especially in low and middle-income countries. We pride ourselves with the fact that we have been able to treat these infections and at least save millions of lives. For most NTDs, we still lack tools for prevention, diagnosis, and treatment that are simple, safe, and effective, and that can be easily integrated into already overburdened health systems. Therefore, at DNDi, we advocate for public policies that will enable a more effective and equitable global biomedical research and development ecosystem. We advocate also for being grounded in scientific evidence generated through our own research and development programs. And we also do translation of innovative science into accessible treatments for these populations, thereby, of course, providing a compelling case for policy change that is both data-driven and impact-oriented. But despite this progress that we are alluding to at DNDi, we still have a lot of challenges, especially in Africa. For instance, in Africa, only 2% research that we have contributes to the global burden of research. For most NTDs, inadequate investment, especially in research, due to lack of feasible returns from pharma companies, actually threatens the very sustainable disease elimination that we have started. Evidence, therefore, should not end in publications. That's what we believe at DNDi. It must inform the decisions that shape how resources are allocated, how interventions will be prioritized, and ultimately, how lives can be saved through the innovations that we make. So today's dialogue is about bridging that gap between research and the real world impact. And together, between ourselves and you partners and colleagues, we have an opportunity to reflect on how to strengthen these partnerships, to empower our own R&D portfolios and support our governments to be able to institutionalize the use of evidence-based policy, particularly for NTDs, and especially now as we look at climate and health interactions as we know them. So by addressing these research to policy transition gaps, we need also to improve communication between scientists and policymakers. And today's webinar, we will be looking at exactly that. How do we make health policies in Africa effective? This webinar also marks a turning point for us between DNDi and APHRC, where we are going to formalize an MOU to jointly tackle diseases that are of importance to neglected populations. We look at our collaboration with APHRC as a shared vision, where we will jointly mobilize resources, conduct science through research and policy and practice, and strengthen research capacity in our different domains, as well as promoting ethical data sharing and evidence generation to advance general public health as we know it. And by doing this, we'll be able to foster linkages among academia, industry, and policymakers as well, and enhance knowledge management dissemination and policy dialogue. Therefore, I'm looking forward to having a robust discussion among ourselves here to see how best these gaps can be filled as we move forward to address issues affecting neglected populations. Thank you and welcome.
Thank you. Thank you, Prof, for that powerful opening statement, clearly pointing out that evidence should not end at the publication, but must inform decision on how lives will be changed. And also pointing out that the partnership will result to shared vision. It's our hope that from this discussion, the partnership between DNDi and APHRC will also continue widening up and also include all the actors and the partners and the participants who are in this webinar. So thank you so much. That was the first session or the first phase of our webinar, which was the opening statements from the two organizations. We'll now transition into the panel discussion, and we have a powerful panel of 5 individuals from different organizations. Unfortunately, or apologies that Dr. Sultana Matendechero, who is from the Ministry of Health, was not able to join us, but he will be joining us as we continue. He was the one who was to provide the first presentation in the panel. But because of that, we will transition into AUDA NEPAD, which is Dr. Charles Sandy. Dr. Charles Sandy is a Senior Program Officer in the African Medicine Regularization Harmonization, AMR program within the AUDA NEPAD. Dr. Charles is a public health physician and a researcher with extensive experience in communicable disease control, regulatory policy, and health system strengthening. His expertise spans from HIV, AIDS, tuberculosis, neglected tropical disease, clinical trials, and research ethics. He has held leadership roles in national, regional programs focused on building resilience in harmonized health products regulatory across Africa. I want to bring him on board, but I'll bring him by asking him the question, Dr. Charles, what are the Africa's strategic priorities for the NTD elimination, and how can they be aligned with the national policies? Welcome, Dr. Charles.
Thank you, Johnson, for having me. Sorry, I've got a bit of a poor background, but I hope you can all see me. Would like to acknowledge the invitation to participate in this important webinar for neglected tropical diseases. And as AUDA NEPAD, this is one of our key developmental challenges on the continent, given the numbers of people who are affected by neglected tropical diseases, imposing a big burden that you are all aware of as practitioners in their day-to-day livelihoods. So, as the lead agent responsible for development for the Africa Union, we serve as an important bridge between what is set out on the political landscape with what science is telling us, what innovations we are adopting and coming up with, to practical implementation on the ground. So what we focus on is how to ensure there is policy alignment between the NTD priorities that are outlined from the global level, from WHO, and what we also are expecting to develop as part of Africa Health Strategy and the Agenda 2063 aspirations, with the aim of seeing both inclusive growth and sustainable development. So how does AUDA NEPAD do this? We do this through a number of mechanisms. One of them is through intersectoral collaboration and coordination, taking cognizance of the various facets of priorities, stemming from water and sanitation, hygiene, nutrition, mosquito vector control, as well as education in general. So we need to see there is a good synergy and coordination between all the different efforts that are happening in those spheres. So that's where we come in as APHRC to play a role in coordination, and this happens through various fora and through the Africa Union itself. Then we are also aiming to provide technical support and capacity building through our relationships with the RECs and also member states. Directly with RECs, a number of initiatives are actually in play. Currently, we are actively developing a 6-year multi-country proposal, which aims to support the East African community, as well as some countries in East Africa, as well as Principe and Sao Tome. And our role will be to provide strategic guidance and help in capacity development of those member states so that they have robust national NTD plans. The discussion is also on specific activities related to improving data collection, surveillance, the M&E aspects, and the rollout of preventive chemotherapy. And at the same time, we are focusing on how do we sustain the NTD response. As part of those initiatives of sustaining the response, we have a program which is called a program for financing of Africa's health. And with this program, we have been supporting countries to develop what are called regional and national financing hubs. And through these hubs, we want to unlock domestic resources and ensure that not only are these resources going to health, but we are also helping in putting NTDs high on the map. So in a nutshell, I hope I have drawn in some of the work that we are doing as APHRC, but I'm happy, Mr. Chairperson, to also come in with further inputs depending on what you would like us to share with the audience. Over to you, Mr. Chair.
Thank you. Thank you very much, Dr. Charles. Thank you. I hope you have been able to adequately present on the topic that you are to do so, and you will be available for any questions or any guidance or clarification that we will get from our distinguished attendees. So maybe just to point out that you could be able to ask your question via chat, but at the end of the presentation from the panelists, we will also provide an opportunity for you to voice your questions, seek clarification, or even provide some suggestion on how you think we could be able to handle this particular topic of discussion. Thank you so much, Dr. Charles. So at this particular point, I want to transition to the next speaker, which is Mamadou Diallo from the African Population Health Research Center. Mamadou Diallo is the head of Policy Engagement and Communication. We call it PEC, which program within the African Population Health Research Center. Dialogue leads the Policy Engagement and Communication Program, bringing over 27 years experience in international development and policy advocacy. He has led country initiative with organizations such as USAID, EU, UNICEF, the Gates Foundation, with a background in he has a background in anthropology, business administration, professional coaching. Mamadou is known for his expertise in political economy analysis and his commitment to equity and inclusion and pro-poor development. So I'll bring Mamadou by asking him the question, which is, what does the strong knowledge ecosystem for neglected tropical disease policymaking look like in Africa? And maybe as you respond to that, you can also be able to point out how research institutions could build stronger ministry linkages. Welcome, Mamadou.
Thank you, Johnstone, for having me here. It's a pleasure to be able to share. Just before I get to the policy, the knowledge ecosystem can be functional. How do we know when it is functional? Let me just maybe start by underlining the two keywords in that question about, one, the ecosystem, and second, policy. When we think of ecosystem, we are thinking of a complex system, a web of interactions, of relationships, of interdependence, of co-ownership, of co-shared space, but also a connected space. Now, when you think of policy, whether health policy or any other public policy, what you are thinking...
Sorry, Mamadou, we were not able to see you, but now you are visible. We can see you. Thanks.
Oh, sorry. Yeah, so when you think of the ecosystem, like I said, you are talking about a shared space, but also a web of interconnections, of co-sharing, co-ownership, and really having interdependence. Now, when you look at a policy looks almost the same. It's just another complex space that goes beyond technical or scientific exercise. So that said, you have it's like both knowledge ecosystem and health policies are about power, people, and at the end of the day, politics. Both of them are about power, people, and politics. So let me come now to how do you recognize a functional knowledge ecosystem. I think it's been said by Professor Kariuki, but also by Dr. Naba, that the first thing I would like to suggest that there are maybe three characteristics that can inform a functional knowledge ecosystem. The first characteristic I would like to submit is that a functional knowledge ecosystem, like any ecosystem, provides value. So value will be the first thing, the first characteristic. Recently, I was in a workshop and I heard somebody told us, a policymaker, that they have an unwritten rule in government that says that ignore what doesn't make sense. Ignore whatever doesn't make sense. And let's not focus on going into the argument of who defines what makes sense or what doesn't make sense. But the bottom line is ignore what doesn't bring value to the ecosystem players. And I think that's the first thing. The first way you want to appreciate a knowledge ecosystem, and is, again, it has been said, is really what is the value it is bringing to the partners, to the people, to the communities we are wanting to serve. So creating value, or rather co-creating value, will be the first sign of a strong and functional ecosystem. So starting with the why. Value, not really about any ill-fitting theory, but value, whether that's equity, whether that's efficiency, whether that's anything like you said at the beginning, Johnson, actionable and real impact value. The second thing, let me add to that, the second characteristic, and I've said it, that ecosystem is about connection. And you said, how do we connect? How do we engage policymakers, ministries? So the second way or characteristic of a functional ecosystem, knowledge ecosystem, is really about how authentic the connections are, how authentic the partnerships are, so that you realize that the partnerships are not just let me as a researcher engage the ministry as a stakeholder, or let me as a ministry engage the science as a stakeholder partners, but let it be authentic connection, not transactional, not just based on a simple stakeholder mapping and trying to find out what is the demand or what is the need. I think that asks for more humility from each other, but also empathy, listening. Like I said, in the ecosystem, there is that interdependence. So it's about listening, it's about accepting other truths, it's about being vulnerable and manifesting that empathy. So what Africa needs is really to say, let's build those type of connections where we can come together and ask ourselves, what is the value that Africans need from us? What is the value, what is the expectation that people, the communities, and the other people are waiting for us? Let me say the third characteristic is really, as an ecosystem of knowledge, to be enabling, to be functional as an ecosystem, as a knowledge ecosystem. You should be enabling. Of course, you should be informed by the context, but as we often said, truth is about context plus facts. So context is key in ecosystem. And context in the knowledge ecosystem is evolving, is changing. So it's really about creating that enabling framework, enabling environment to be able to build a strong, a functional knowledge ecosystem. And that's enabling work. It's not only about capacity building. Of course, a big investment is needed in capacity building, whether capacity of individuals or institutions, building the capacity of early career researchers, building capacities of program managers of institutions, but it goes beyond capacity to really also look at the whole capacity, but also the tools, the resources, the networks, the platforms that can be really available to be able to transform and adapt continuously to the ecosystem. So just in short, again, to come to your question, you can recognize a functional knowledge ecosystem by the value it offers to the people, by the quality of the connections between science, policy, and practice partners, and the resulting power balance that you create, but also by the enabling environment that you are going to support, an enabling environment that is informed by the political awareness, but is informed by whatever is the context is looking for. So again, thank you. I'm happy to come back if there are questions, but yeah, in summary, it's about value, it's about the value you bring, the connections, and the enabling environment the knowledge ecosystem creates. Over to you, Johnson. Thank you.
Thank you. Thank you. Thank you so much, Mamadou, for summarizing the whole item of knowledge ecosystem, which is bringing out the value, quality of connection, and also enabling environment. So at this particular point, I want to tie this with the research element, because basically we want to have the knowledge or to improve the knowledge ecosystem within Africa. Then the element of research has to be active. And I want to bring back Professor Kariuki from DNDi, and just to ask him the question, which is from DNDi experience, how can we ensure that research and development findings inform policy and practice? And maybe just as you also respond to that, you can be able to share lessons from DNDi partnership in Africa. Welcome, Professor Kariuki.
Thank you very much. Thank you very much, Mr. Kotut. At DNDi, we work a whole value chain, right from drug discovery to clinical trials to partnering with pharma and other collaborators to be able to make drugs available. And then, of course, see them through access to those patients that are needy, those populations that are neglected. So we work the whole value chain in an R&D platform that works and is successful because of partnerships. And what I'll do, I'll give you a couple of examples of what DNDi has been able to do in terms of translating R&D into policy, but also into action and products that support our mission to be able to deliver treatment to the most neglected NTDs for populations that are also neglected. A few examples here include our role in treatment of sleeping sickness, which is also called human African trypanosomiasis. DNDi is well famed for developing the drug called fexinidazole. And this was the very, very first oral treatment for both stages of the disease that we call trypanosoma gambiensiensis, sleeping sickness. It's one form of sleeping sickness by a specific protozoa pathogen. And the evidence from DNDi clinical trials in countries like the DRC and the Central African Republic was able to inform WHO treatment guidelines and algorithms. And this led to policy adoption by the national control programs for sleeping sickness. It was also approved by regulatory authorities and included in the WHO guidelines, enabling easier deployment, especially in remote areas where this disease occurs. Of course, the result was that we now have simplified treatment that can be delivered at any primary healthcare level. And this definitely is going to accelerate and promote elimination of sleeping sickness. Of course, that's one of the priority areas for WHO by the year 2030. This success couldn't have happened except through collaborative efforts with national ministries of health and other partners to ensure that this gets into the national health systems. Another example, a quick one that also DNDi has delivered on, is in the treatment of visceral leishmaniasis. And here DNDi has worked with national ministries of health and various research institutions to develop new treatments for visceral leishmaniasis, and particularly utilizing the platform we call Leishmaniasis East African Platform, which facilitated clinical trials and effective strategies into ensuring that this treatment is integrated within ministries of health. Here, we are talking about two new combination treatments that are very, very effective in treatment of visceral leishmaniasis, Ambisome and methotrexate. And this combination has now led to WHO being able now to put VL, as we know it, on the radar for elimination. So another of an important milestone for DNDi. Another one is the treatments now that we have also developed for another fungal disease that we know is called mycetoma. And this is, again, another devastating disease affecting, again, the most neglected among the neglected. And we have ongoing research for a new treatment that we have trialed in Sudan. And this new treatment now also has brought global attention to this neglected condition, that now we have available treatment for populations that would otherwise have gone on to die because there was no treatment in many, many places around the world. where mycetoma is endemic. The evidence has also influenced WHO's inclusion of mycetoma in the last 2 years in its list of NTDs. And this is, of course, shaping global research and development priorities. So we have a number of other key policy areas that we are able to influence, and we'll be discussing these further. But for now, those are key examples of where DNDi has been able to influence and translate research into products, especially health products that go on to change the lives for the most neglected populations. Back to you. Thank you.
Thank you, bro, for bringing out real research and the diseases that they were focusing on in Africa, and also the collaboration with WHO and other partners in terms of addressing those neglected tropical diseases. I know Prof will agree with me that this research and the intervention being carried out requires resources. It is resource intensive, and it also requires some element of funding from partners, other organizations. And at this particular point, I want to bring on board Dr. Ngozi Erondu, just to give us the perspective of the role of philanthropic and traditional funding. Dr. Ngozi is, as a PhD, MPH, is a technical director at Clyde, which she leads a technical team and serves on the leadership team. With over 15 years experience in infectious disease epidemiology, policy, and practice, she has worked across more than 40 countries globally. Her role includes academic position at the London School of Hygiene and Tropical Medicine and Georgetown University, and the work with the CDC, World Health Organization, the UK Health Security Agency. She co-chairs the O'Neill Commission on Racism and Structural Discrimination, and a fellow by distinction of UK Faculty of Public Health. Dr. Ngozi, just pointing out what Prof has been able to bring out in terms of the achievements on what DNDi has done and the need for more resources to support this particular process. I want to ask you on how can the private donors and the philanthropic institutions drive or support policy-linked research to neglected tropical disease? And maybe, if possible, we can bring out some compelling cases on how these can attract funding and meet competing priorities and the current funding landscape. Welcome, Dr. Ngozi.
Thank you so much, Johnstone, for that wonderful introduction, and my thanks to APHRC and DNDi for the invitation to speak at this webinar. It's an honor to join you on behalf of the Global Institute for Disease Elimination. GLIDE is what we are called, is a catalytic philanthropic and technical institute that accelerates evidence-driven approaches to disease elimination by supporting research, innovation, and by partnering with African countries and countries all over the world. We are part of Earth Zayed Philanthropies, which brings together the global and domestic philanthropic initiatives of His Highness Sheikh Mohammed bin Zayed Al Nahyan, who is the ruler of the United Arab Emirates. And hi from Abu Dhabi to everybody on this call. So it's a great question about, what is the role of philanthropies when we're talking about disease elimination, but especially when we're talking about NTDs, which continue to affect nearly 2 billion people. But when it comes to the research for NTDs and research and development spending, it receives less than 1% of funding globally, which is one of the reasons why DNDi and other organizations were created. One of the major initiatives and interventions for reaching neglected populations that are affected the most from NTDs, as we all know, is mass drug administration. And that has given us enormous gains, but we've been using a lot of the same tools as a lot of the other speakers have mentioned. So in the next decade, we need new tools. We need, there are newer treatments for onchocerciasis, for example, like moxidectin. We need new diagnostics for neglected diseases, including lymphatic filariasis and schistosomiasis. We need improved vector surveillance and integrated data systems. But these innovations, as they're being developed, they do not scale on their own. They require evidence generation, operational research, regulatory alignment, and community insight. All of these areas where DNDi and APHRC can be really critical, as well as other CSOs and research institutes. And for me, this is where the strategic role of philanthropy can really, really help. And there are 3 areas that I'll focus on really quickly, since I want to stay within my time. And I'll start with de-risking innovations for governments. Very understandably, governments often hesitate in funding new tools, especially if those tools don't have clear evidence when it comes to feasibility, cost, community acceptance, and system implications. So philanthropy can support early pilots, demonstration studies, community consultations, and economic analyses that really help to generate evidence that can be used to support decision-making. And this reduces the risk and shortens timelines of, that kind of innovation to uptake when it comes to implementation into interventions. And it really helps countries to act faster and with greater confidence. The second strategic role for philanthropy that I would say is funding the missing middle between discovery and policy. So this is when you have the science and, some of these innovations for NTDs, they're not failing to be scaled because the science is weak. It's because there's little funding when it comes to translation. So really doing the work to move it from a promising evidence to real world decisions. And so philanthropy's greatest value is that it has flexible and patient capital, right? It's something that philanthropy can do that bilateral donors might not be able to do because of kind of entrenched government timelines. So philanthropy can support what we often call high risk, high reward innovations and parts of research and development. And this includes implementation research, operational feasibility studies, cost-effective analyses, regulatory and policy preparation. And for GLIDE, this is one reason why we really focus on operational and implementation research. We see philanthropy as a partnership and not charity. And we call ourselves a think and do tank because we really focus on investing in researchers and research. And our goal is really to accelerate evidence that support policy uptake and leaves countries stronger than before. We have several initiatives. One is our Falcon Awards for Disease Elimination that really looks at where is there a dearth of evidence, or where is there evidence that needs to be the learning and the knowledge of this evidence or these new tools need to be scaled as far as to improve awareness, increase awareness. So one thing that we have done, for example, through our Falcon Awards for Disease Elimination, is have an edition that was really focused on looking at climate and infectious diseases and how that affects the pathway to disease elimination. And we funded 10 grants, and we actually really targeted early career researchers, which a lot of funders look at high risk because they haven't demonstrated success in certain for long enough in certain areas. And so this is one way that we were supporting kind of this high risk, potentially high reward research. Another thing that we do is really focus on these areas that everyone is talking about, but we don't really have the evidence to say which way we should go. One big area is integration, for example, with all of these cuts from USAID and other bilateral funders. We have been talking a lot about efficiency, but what does that look like? Which disease programs can be integrated and when, especially when you're talking about disease elimination, that a lot of the several NTDs are on the agenda for elimination. You might not be able to integrate when it comes to the very technical parts, when you're looking at different vectors and you're looking at different laboratory techniques. But it makes more sense to integrate when you're talking about policy and advocacy or fundraising or community engagement. So really understanding what that looks like, what the policy of integration can mean is something that we are investing in as well. And that really brings me to the third way that philanthropy, what the philanthropy can do strategically in this space, which is, building on what Professor Kariuki said, that evidence should not just end at publication. Philanthropy really can help to build that larger or that broader evidence to action pathway. So specifically strengthening the evidence ecosystem, which several of the speakers have already talked about. Literature is really clear about this. Philanthropy is most effective when it strengthens ecosystems and not just isolated projects. So we can support knowledge brokers such as APHRC and operational research partners such as DNDi to turn scientific findings into policy recommendations, community engagement strategies, and context-specific evidence that accelerates the adoption of these findings or of this evidence. And our role is not to only fund programs, but also to catalyze momentum for major policy agendas. So this includes the new public health order, the Lusaka agenda, and even talking about domestic resource mobilization. Sometimes in order to make this, to kind of translate these big initiatives from rhetoric to reality, what you need to do is just bring people together. You can bring together thought leaders and experts to really ignite the spark that inspires country-led initiatives and then meaningful policy change. And while, philanthropy and funding full stop can really spark change, when we're talking about actually carrying that out and bringing that to the community level, that's where CSOs make a huge difference. So I've talked about the role of philanthropy, but I'll just really quickly talk about how CSOs can demonstrate how they can translate evidence into real action. I think this is by convening ministries, scientists, communities around the data and making it understandable to different populations. I think that's really important. But also, I think using catalytic financing to really make it more national, make regional and global initiatives more national, more local and more contextually specific. So CSOs can be really good at making their role, the role of facilitating this knowledge translation, making that role really clear when we're talking about different regional and global discussions, but making that role clear at the country level as well. So in conclusion, NTDs require innovation, and in order to make sure the innovation can be, actually accessible to the communities and the governments that need it, philanthropy can play a really catalytic and meaningful role here. And there are other institutions that really have a lot to do in order to help us to facilitate that, and that includes CSOs that can help. So I think what we really need to do is just align our scientific strengths as well as our institutions and the catalytic funding to make sure that NTDs can be eliminated. Thank you.
Thank you. Thank you very much, Dr. Ngozi. Thank you for bringing out the role of philanthropy and also the CSOs in this particular topic that we are discussing. So at this particular point, I would want to open up for any questions, any suggestions, any addition from the audience. I will be able to come back once more with the last round of questions for the panelists. But now I would want to open up. And we had earlier indicated that you are free to use the chat in terms of sharing any question that you have. So far, we have been able to see one of the questions, which is from Alex. Alex, if you are here, maybe you can voice your question. Alex Manyasi.
Yeah, sorry, I hope you can hear me. Apologies. I guess my question was more trying to get the panelists to make a comment with regard to the connection between elimination of these diseases with WASH. And I think looking at WASH as one of the companies that can be a good way, someone mentioned the community mobilization, trying to ensure that the community through the WASH approaches is involved in making sure that complete elimination happens after the drug administration. Thank you.
Thank you. Thank you, Alex, for that. So trying to bring out the connection between WASH and the neglected tropical disease, how that connection can be brought forward. So I think I will ask Professor Kariuki to prepare to respond to that. But meanwhile, we can pick some few other questions. Blessing, please come on board. Blessing.
Yeah, thank you. Thank you, and thanks everyone. Interesting discussion going on here. Years ago, I did work on onchocerciasis, which is called river blindness in Nigeria then. And people think that the blindness is coming from the river, not knowing it's not the river per se. Yeah, so I was thinking around the point Professor Kariuki made about supporting our government. Okay, and then I'm looking at the funding landscape. Even the last speaker, Ngozi, she was speaking from the UAE, where the ruler of UAE is actually behind this glide. So I keep wondering whether that the lack of our own funding, may explain the neglect we are seeing. And if you have your own funding, I mean, the tropical diseases are mostly here in the tropics. It affects mostly low and medium income countries, particularly where our region is located. So I'm really asking whether, how do we unlock own funding? How do we make our governments put the money, African money, where African challenges are, particularly in this issue, so that we don't keep, relying on funding from beyond where the problem resides. Not that if you get that help, you would not take it, but those, if we're supposed to be at the forefront, whether it's African philanthropy or African governments, how do we really unlock own funding so that we can focus on what our priorities are? So I'm thinking aloud, but I guess we may have success stories which we can learn from and build on. Thank you.
Thank you, Blessing, for that. So maybe we can pick one more or two more, then we will go straight into the panelists to respond to those questions. Please feel free to raise up your hand and mute and ask. Peter Wanyama, please go ahead. Peter Wanyama, go ahead and ask your question.
Yeah, so I'm very much grateful for this beautiful and very insightful discussion on these various topics. And my question goes to Professor Kariuki. Normally, the synthesis of those, the potential drugs or the drugs are mostly done in Western countries. Is there a way the African continent can also participate in this kind of discovery, so that I'm looking at it in the long term, so that we can also train our own people to discover our own molecules? Then the second question is, looking at the whole scenario, as the previous person has talked about, we need to be laying policy strategies so that this African government can be held accountable, so that we can have our own fund to undertake this kind of research, especially on the neglected tropical diseases, and address our own challenges. Thank you.
Thank you, Wanyama. Thank you for that question. Yeah. Catherine, please, you can go ahead and ask your question. Catherine?
Yes, I've been unmuted. Yes, I think I want to start by thanking also the panelists for a very engaging webinar and for lots of useful insights that I hope we'll be able to follow up after this. And my question was to Mamadou, because Mamadou talked about value. And I think value can vary depending on the perspective one is looking at. So who defines value?
Thank you. Thank you, Catherine, for that question. So maybe we can allow the panelists to respond. So far, we have questions for Mamadou. We also have questions for Professor Kariuki, which are 2 questions. One is on Peter Wanyama's questions on drugs from Western. How can they be also, how can we also develop the capacity of Africa to be able to produce drugs for the African diseases? Also, the other one was on the issue of funding landscape, which was pointed out by Blessing, and I will also allow maybe Professor Kariuki to respond to these, and also Dr. Ngozi to bring out the aspect of local funding, because he pointed out that maybe lack of funding may explain the neglect aspect that we are discussing. And Professor Kariuki also, there was a question from Alex, which was the relationship between WASH and the neglected tropical diseases. So maybe we can begin from Mamadou. Please unmute and please go ahead and respond to the question in terms of the value.
Thank you, Johnson. Thank you, Catherine. Yeah, I will start with that question about value. What is value and who defines value? And I said in the discussion that value should be co-created. Also insisted that at the end, the real value is when people, the health and well-being of the people have changed. When you are able to make that policy, evidence-based policy, and that policy is able to change, to transform the lives of the people. In particular, as we are talking about health policies, transforming, improving, enhancing the health and well-being of the people at the end of the day. That's what is value. And that should be co-created. I think that's the whole essence of thinking systemically. So it should be co-created, not only created by a researcher, but creating that space, that interface between science, policy, and practice, being able to get, again, that's where the whole issue of who defines, who gives himself, who is given that power to define is important. So I think it's co-created by both science, but also policy, but at the end of the day, by the people. The people should be listened to, where I talked about humility, I talked about being able to provide value, is really being able to transform the lives of the people, and that should be co-created by listening to the people we want to serve. But because at the end of the day, our question is, what is it that we science policy makers are uniquely positioned to deliver to the world we are serving, which are the communities and the people around. So yeah, I'll stop there. I think there was a question about the digital platforms and the role they play. Huge role, because more and more we know, I think huge role in terms of accessibility, huge role in terms of really improving the fairness of people of different capacities, but also different needs, being able to access information. So at APHRC, we have a number of those digital platforms. For instance, we have a virtual learning academy, which is really covering a diverse range of services, content for capacity building, for different, not only for research, but even for policymakers who can come through different policy fellowships. I have access to that type of content, but also we have resources like the Africa Research Connect. Francis is online. He led that project where we are supporting the visibility of African researchers, African research institutions, and we are working even on other platforms where we are able to do policy repositories, but not only that, we have a small project we are working on AI policy lens. So at the end of the day, that will be able to even analyze the content of policies based on a few criteria, 3 mainly, and be able to say, okay, this policy is not comprehensive, this policy is not having a human rights equity lens, this policy is not aligned. So yes, those platforms exist, and we are continuously developing even more of those. So yeah, I think just before the Professor Kariuki talks about the WASH thing, yes, Alex, I think the WHO developed a whole guidelines on WASH and NTDs, and a few years ago, I was in a process where we developed the WASH FIT, the Water and Sanitation for Health Facility Improvement Tool. And this is now used even in Kenya here, because there is a WASH and institutions technical working group, using that, looking at, because the link with NTDs is double. It's first of all about the environment, because there are different routes of transmission, but it's also even how WASH can support treatment and care. Not only as an infection prevention control tool, but really having WASH accessible in a healthcare facility is also a question of dignity. Over to you, Johnson. Thank you.
Thank you, Mamadou, for unpacking that and also responding to Alex's question. But just at this particular point, I want to bring Professor just to also voice on the same and also respond to the question from Peter Wanyama, which was on the issue of drugs for Africa. So, Professor, please welcome.
Thank you very much, colleagues and participants, for those very, very important questions. If I may start from the point of view of drug discovery, especially for NTDs, definitely drug discovery in itself is an art, but also a science. And in the experience of DNDi, this is one area that even requires much more partnerships and collaboration than any other phase of developing new molecules for NTDs. Now, back to your question regarding how best can we bring capacity or build capacity or enhance capacity for Africa in drug discovery. Critically important here is the fact that we are already training at DNDi capacities in various institutions that we collaborate with. And we do that by ensuring that, for example, the institutions of higher learning that we work with become part and parcel of our drug discovery portfolio. So most of the drugs, including those that we are using currently for management of sleeping sickness, for VL, for mycetoma, for even hepatitis C, and even for Chagas disease in Latin America, have actually been developed in partnership between the global north and the global south, as we call it. And most important here is that there is a new initiative now through even our continental entities like Africa CDC to be able to hasten and facilitate the local manufacturing of these antimicrobials and other health products here in Africa. And with that move and with that facilitation, we are, of course, ensuring that for DNDi, for example, that we engage with our partners for tech transfer to come to Africa, where then we can be able to establish local hubs for both discovery, but also for local manufacture of health products, including, of course, diagnostics as well. So it's a process. It's something that is happening. But most critically important for me here is that we must work, especially with the institutions, like the higher education institutions, universities that have School of Pharmacies and other institutions that also work on drug discoveries, especially now in the era of artificial intelligence and machine learning, to be able to utilize technologies to ensure that we are in the forefront of drug discovery, even as we collaborate and cooperate and partner with others. We can't do it alone, but in the long term, we are able to transfer that technology and develop our own capacities. There was another question regarding the association of WASH and, of course, NTDs. Yes, of course, WASH is a tool that is quite relevant and cross-cutting, almost transversal for control and management of many, many infectious diseases, notwithstanding, of course, NTDs as well. So whenever we are managing NTDs where they occur, especially among neglected populations, we do this in an integrated version. We don't do it just for purposes of just treatment, but we incorporate also aspects of working with those that are doing, so for example, vector control, those that are working on nutrition, those that are working on WASH as well. So yes, to your question, WASH is a pertinent tool and part and parcel of a strategy to control some of the NTDs that especially may be related to hygiene, issues around hygiene in households, issues around hygiene in communities as well. And we know a number of them, including river blindness and so forth, schistosomiasis and filariasis and so forth. The other question of funding, I think as far as DNDi is concerned, what we found most useful is to ensure that our partners that we are seeking funding from really understand why controlling NTDs is going to contribute not just to the welfare of communities, but also to an economic empowerment of families and communities. And with that, then those communities and families end up being contributors to nations' wealth and nations' well-being, and they become a robust part and parcel of a community, of a nation, so that by investing in them, we are investing in something that has returns, not just in the short term, but also in the long term. So we work with partners, and most of who are pharma, some private, some multinational, but they understand from the beginning that we are doing this not just for the short term, but for the longer term sustainability of populations that are healthy and contributing back to give society back in terms of progress and growth. I hope I haven't forgotten anything else, but Johnstone, you could remind me.
Thank you, Prof. I think you have adequately covered the questions that were asked specifically to you. So at this particular point, let me bring on board Ngozi. There are two questions that you would respond to. The first one is what Professor was responding to, which was on the issue of funding. And as pointed out by Blessing, was saying whether the resources could also be available within Africa. What can we do so that we trigger resources, even if it is private philanthropies? Do we have private philanthropists in Africa who are ready to commit these kind of resources, and also the governments in Africa? How can they be able to commit more resources to address this neglected tropical disease? The other question that we would also want you to respond, which was on the chat, is that the World Health Organization neglected tropical disease roadmap emphasizes on integrated multi-sectoral approaches. How can neglected tropical disease elimination programs best leverage on evidence from sectors outside health? I think Professor attempted to bring out the aspect of that relationship, which includes WASH, agriculture, education, to inform policy. Over to you, Dr. Ngozi.
Thank you so much, and thank you for all who asked the questions. I think it's a really important question to ask about unlocking African finance, especially when we're in this era of reimagining global health with, and talking a lot about country ownership and country leadership. There's only so much you can direct when you're talking about other people's money. So I think it's very important to talk about how we own that in Africa ourselves. So when we're talking about NTDs, which is, if you think across health issues or priorities, it's usually often lowly prioritized. I think the first thing we need to do is how do we align NTD priorities to the broader political and economic agendas that African governments are already invested in. So that means linking that to primary health care, to disease surveillance, or even taking it a step forward to health security in general, universal health coverage as well. These are, agendas that most African countries have already bought into, and not just within the health ministry, but also when you look at like the Ministry of Economics, or if you think about One Health as an agenda and looking across our agriculture and animal health as well. We really do need to get away from vertical disease programs. And even though NTDs are 21 different diseases, it's like we shoot ourselves in the foot by saying that neglected tropical diseases are neglected. It's just kind of human psychology. If you're already hearing that something is neglected, then you think that you can neglect it more. It doesn't seem that much of a priority. So I think that's one task for all of us, is to think about how we rebrand neglected tropical diseases. But when you look at NTDs, or when you frame NTDs as being part of a health system, not just a health system, but also, as we just heard, part of productive, strong economy, something that contributes to economic growth of a country. And you don't look at it just as like, this foster child of donor dependency, but you really situate it as a core public health investment. One thing that one of the keynotes said at the very beginning is that, we're in this age of AI, we're in this age, we're in the fourth industrial revolution. Why do we still have NTDs, especially those that, have treatments that have that we have ways to prevent them, we have ways to treat them, and we have ways to eliminate them. So I think that just being able to craft that message and that narrative to decision makers is really important. And then all the things that we said today, you have to provide governments with clear evidence, with costed plans, with co-financing pathways. So yes, we need to increase domestic contributions, but that won't happen overnight. So working with funders and philanthropic organizations, and thinking through like these transition plans, like if there's a 5-year plan and you need donor funding for the first 2, what does the transition from year 2 to year 3 look like? I think that's what can make domestic investment both feasible and predictable. And just really quickly, I wanted to give a couple of examples of countries that have already done so. So Rwanda they have full domestic financing for Schisto and STH MDA. It's a very strong example of a full domestic financed initiative, or program, I would say. And they do this through school-based MDA for Schisto and STH. Zero reliance from external donors or for operational costs. The government funds all of the teacher training, distribution, and monitoring and evaluation of this program, and it's integrated within the school health and primary health care strengthening. And it worked really because NTDs were not positioned just as a health issue. It's positioned as education and a productivity issue. And that can really help to persuade decision makers and secure stable domestic budget lines. And since Blessing and I are from Nigeria, I have to give a Nigerian example, even though it's statewide, but a state in Nigeria is the size of a mini country, so I think it's fair. So in Nigeria, there's a state level co-financing for Onco and LF in several states, including Plateau, Kaduna, and Kano. And they co-finance onchocerciasis and LFMDA. They integrate NTD activities into primary healthcare budgets and directly fund community-directed distributors. And why it worked in Nigeria and these states is because civil society organizations provided clear costed plans and demonstrated the economic burden of NTDs on both agriculture and labor productivity. Both these two areas in these states are very important money makers, basically, and so they were able to persuade decision makers that this is an economic issue. So I hope that's helpful. Thank you.
Thank you. Thank you very much, Dr. Ngozi. Thank you for providing African examples and proving that it is possible for Africa to commit resources based on the practical examples of what is happening within Africa. At this particular point, I want to bring on board Dr. Sandy, and we have a question for you, Dr. Sandy, which is on the role of AUDA NEPAD. So given the shifting global aid priorities and the push for greater country ownership, what concrete strategies is AUDA NEPAD pursuing to help African Union member states increase and sustain domestic financing for neglected tropical disease and elimination efforts? As you respond to that, maybe you can say something about what the AU is doing on domestic resource mobilization or the Lusaka agenda. Over to you, Dr. Sandy.
Yeah, thank you, Chair, for those very good questions which come on the those questions which are coming on the heels of some very good examples of action from Rwanda and Nigeria. I think it's good when we have such interventions at country level, sustaining the NTD responses. I think for me, first of all, what I would like to highlight is the key issue of advocacy, high-level political advocacy for NTDs, so that they don't remain NTDs. And I also like the contrasting picture which said we should not consider them as neglected. And I think the advocacy that we are seeing so far is rather at a low level, where the NTD program manager is doing his best, but is at a lower level. And we need to elevate the conversations to at least the ministerial level, Minister of Finance, so that we can then ensure the necessary resources, the necessary prioritization, the necessary integration within the different aspects of the government happens. And I think as well, we should take advantage of the interests of our leadership. In 2019, there was an African leadership meeting which really came up with a decision to say, let us put more money in health. And as a direct result of that African leadership meeting, we do have at NEPAD a program for investment and financing of Africa's health, which is called the PIFA program. And with this program, we are working together initially with 11 countries to support them to unlock domestic resource mobilization through various innovative ways, including blended capital initiatives, and looking at how we can promote the health markets. And as part of that, we have regional financing hubs, which are being established in SADC, in East African Community, I think in West Africa as well, if I remember well, in ECOWAS region. And in these financing hubs, the issue is how do we replicate having a solid health financing agenda discussion, which translates to having more resources for health and more health for the resources or the financial resources that you currently have. And I'm happy to say that this is already showing some good results in Malawi, for example, In Malawi, the National Financing Hub was established, and through that hub, we have seen an increase in the amount of financing that the country is putting in towards health. And as part of the long-term sustainability, we think this is one way of strengthening domestic resource mobilization, because with this national financing hub, we also have all the country stakeholders coming in to be part of the discussion, that is the Ministry of Finance, local business, and the like. Lastly, I think on a related issue, we are going to be supporting countries with regards to local manufacturing of some of the NTD commodities. We have developed a 24 priority medicine list, which we will be helping countries to come up with the necessary infrastructure, people who do the work, and the partners who support it, the technology transfer, so that we have some kind of long-term predictability of the health commodities for entities. Over. Thank you.
Thank you, Dr. Charles, for that. So at this particular point, we may not take another round of questions based on the time, but I'll just provide an opportunity for each of the panelists to give his closing remarks, just in one sentence, or just a point that he or she would want to emphasize. And I'd want to begin with Professor Kariuki. What is your closing statement? A sentence or two, sir. Welcome.
Thank you very much, colleagues, ladies and gentlemen. Mine is to emphasize that we can be able to deal with neglected tropical diseases as we know them, because they affect the most neglected populations, by taking this upon ourselves as our duty to be able to turn research and development into practice, policy, and ensure that we can be able to eliminate these diseases from those populations that are affected. We have the power. We can work together in partnerships. We can work together with our colleagues in the north. We can work with our colleagues south to south, but we have our power in our hands, and I believe it's possible to do it. Thank you.
Thank you. We have the power in our hands, and I've already seen some of the audiences in the chat indicating their willingness to join this journey. So I think we will provide an opportunity for all of us to move together in this particular journey. Thank you so much, Professor Kariuki. Let me bring on board Charles. Dr. Charles, your closing statement, one or two sentences. Welcome, Dr. Charles.
Thank you. I think let's look at neglected tropical diseases as a developmental challenge which requires taking on board of our politicians and integrating our responses to all aspects of governance, education, nutrition, wash, everything. So NTDs should be part of everything we do in delivering of our government services.
Thank you. Thank you very much, Dr. Charles. Thank you. Thank you for that powerful statement. Let's hear from Mamadou, your closing statement, one or two sentences.
Thank you, Johnson. Mine is again, I think NTDs, like other problems we are discussing, are very complex. But I think this type of platform, bringing this type of partnership, is the way to be able to develop, rather to create an innovation ecosystem, to create solutions that are locally grounded, that we can really be able to collectively address this complex issue. And as at African Population and Health Research Center, we really take seriously our role as an enabler of the ecosystem. So really, we are in this journey. Thank you. Yes.
Thank you. Thank you so much. Thank you. Thank you, Mamadou, for that. Let's hear from Neba. Dr. Alphonsus Neba, your closing statement.
Thank you very much, Johnstone. Can you hear me?
We can hear you. We can hear you.
Okay. Just to emphasize that the environment in which research for NTDs takes place on the continent needs to be really strengthened, be it at the individual level, the institutional level, and the ecosystems level. So we at APHRC, as Mamadou mentioned, we've developed several platforms, and being able to use those platforms like the Africa Research Connect. I think I invite those on the call to go online and search for Africa Research Connect to be able to find out just how useful that is in terms of making the necessary connections that could actually stimulate the further research in terms of contributing towards meeting the goals for NTDs on the continent. Thank you.
Thank you. Thank you, Dr. Alphonsus Neba. Just to close up from the panelists, I want to bring on board Dr. Ngozi to give closing remarks.
Yes, thank you. Well, just to add what all of these distinguished panelists have already said, in the end, eliminating NTDs, as we've all have said, is not just a scientific challenge, it's a governance challenge and a finance opportunity. So at a time, like I said earlier, where global health financing is really shifting and Africa is asserting a stronger voice, philanthropy, yes, we can help to de-risk innovation and strengthen regional institutions and accelerate policy intake, but really lasting progress will come from Africa-led priorities and African funding solutions. So I'm really glad that we were able to have that conversation that conversation today. So I also wanted to add, I think this might be the first time that some people have heard about GLIDE. We do quite a bit to strengthen that ecosystem that several of us have talked about. And if you want to learn more about GLIDE, please visit us on our website. Thank you.
Thank you. Thank you, and really to appreciate the panelists for their contribution. I feel that this may be the beginning of the conversation. We may consider having maybe a quarterly discussion just to check on how far we are doing. But to conclude, I want to bring on board my colleague from DNDi, who we have been working on this together, just to give us a conclusion and sign it off. Shinat.
Yeah, thank you, Johnstone. And I would like to thank all the participants, all the panelists. I think we had very interesting, very insightful discussions, and a lot of key issues, a lot of key takeaways have come up. But I will not go through them. But what I wanted to say is we are going to compile a report. And all the key messages, all the key takeaways will be part of that report. We would like to remain engaged with all of you because as most of the panelists have already said, eliminating NTDs will require a lot of voices. But one key message which kept on coming, I think throughout our conversation, was that there is need for that research to get into or to inform our policy, and yet that's not always happening, and so we need to keep on discussing the best ways. Some of the key suggestions that have been given, we need to see how best we can now use that to ensure that our research is getting into policymakers. Our advocacy is at that high level and at both the regional and the national levels. So I think thank you very much once again, and maybe Johnstone, you can sign us off. Thank you.
Thank you very much. We appreciate for your time, and we look forward to engaging you once again. Thank you.